First scholar today is going to be Saima Hasnin. Saima comes to us from the University of Nebraska Lincoln Department of Child, Youth, and Family Studies. She's originally from, you can correct me if I mispronounce your hometown, Dhaka, Bangladesh. Her faculty member is Dr. Dipti Dev, who I've worked with much in the past. Welcome, Dipti. Thank you for your mentorship of Saima. She's going to present a project called Can Family Child Care Home Providers Preparation and Serving Practices Influence Children's Vegetable Consumption? Saima, I'll hand it over to you now.
Thank you, everyone. I'm going to share my screen. Okay, is everyone looking at my slides? Okay, cool. Thank you everyone for joining us today. And I'm Saima, and Dr. Dev is my advisor, and I'm a doctoral candidate from the Department of Child, Youth, and Family Studies, University of Dhaka, University of Nebraska Lincoln. I'm sorry, my previous studies were done in University of Dhaka, which was in my home country. So yeah, just memory shift. Okay, so my project is targeting to improving children's vegetable consumption in family childcare home settings. And for today's presentation, I'm presenting the first two aims in my dissertation research. For this aim 3, I'm still working on my data collection, as due to COVID, my recruitment was a bit slow, but I'm excited to share with you that we have started collecting the data across the Nebraska. And thank you, Buffett Early Childhood Institute, for allowing me a no-cost extension. And this backdrop for this slide is inspired from the Buffett's logo. So during my first year, I had this opportunity to ask a Buffett representative that what does your logo mean, the dandelion? And I was told that it reflects the rural Nebraska. And to me, it meant that Buffett enables the children in Nebraska to have a strong start and stable future to set them freely fly in their sky. So my dissertation research goal is to address the challenge faced in the rural educators, researchers, and caregivers with the rural children's low consumption of vegetable. So coming back to my research background, early childhood obesity and overweight is a major public health problem, which is an important factor for chronic health outcome and poor academic achievement. According to the Center for Disease Control and Prevention, CDC, 1 in 5 children in the US has obesity. More importantly, rural and low-income children are disproportionately affected with 26% higher risk for having obesity compared to the urban peers. Low vegetable consumption has been an existing problem in the US, and 93% of the US children do not meet the recommendation, despite of the fact that low vegetable consumption has been linked with poor child health outcomes like obesity, overweight, and chronic health outcomes. So the dietary guidelines for Americans recommend that children should consume higher servings of vegetables and even fruits daily. But 44 to 63% of the served vegetables become plate waste in the early childcare education settings. So as I have said, that my overarching long-term goal for this dissertation is to improve children's vegetable consumption. For my first aim, I would like to advance the research field by assessing the validity and reliability of an objective assessment for children's vegetable consumption. This aim tries to build capacity for the researchers and program evaluators, and results for my aim 2 and 3 will eventually lead to preparing professional development materials for childcare providers in the future, and that will help improving children's and providers' taste preferences for vegetable, and then lead to children's vegetable consumption. Okay, so for the first aim, I'm assessing the reliability and the validity and implications of a newly emerged tool to measure children's vegetable consumption. So reflection spectroscopy is basically a technology where a device emits some light and then the light passes through some material and some of the light gets reflected. The machine takes the reading of it and then gives you a score. So Vegimeter is based on this technology and specifically designed to use this reflection spectroscopy method to measure skin carotenoid score in your fingertip. As fruits and vegetables are high in carotenoids, which are coloring substances widely available in colored fruits and vegetables, a higher skin carotenoid score indicates a higher fruits and vegetable consumption. And I'm doing a systematic review for addressing this M1, which has 3 different objectives. First, I will summarize the current research use of the reflection spectroscopy and then identify what has been done to determine the reliability and validity of this tool to estimate children's fruits and vegetable consumption, and then finally identify areas and opportunities for future research. So I had searched across 8 search databases and included 10 articles that met our inclusion and exclusion criteria. So less research has been done in children compared to adults. And there were 2 different reflection-based devices used in these studies, and Vegimeter was used in all 9 US-based studies. There were 8 cross-sectional studies and 2 intervention studies. For my objective 1, in my results, we found that reflection spectroscopy was mainly used to determine the effect of intervention or programs has on changing the children's skin carotenoid score. And other research uses included identifying how, across seasons, children's skin carotenoid score differs. And also the cross-sectional assessment of the skin carotenoid score, or using reflection spectroscopy to measure skin carotenoid score as a proxy for children's fruits and vegetable consumption. So for my objective 2, I found that reflection spectroscopy has not been validated to measure children's fruits and vegetable consumption yet. Additionally, more research is required to assess the reproducibility of the RS-based SCS, the skin carotenoid score, in children. And there are huge areas and opportunities for this future research in this field. And we have found important correlates that are related with children's skin carotenoid score. For example, male children had higher skin carotenoid score than female children, and children with higher body fat percentage had lower skin carotenoid score. And during winter, children's skin carotenoid score was significantly lower than the summer and fall. So as research is limited and still a lot to be done to understand the validity of this tool in children, reflection spectroscopy is an emerging and promising tool that can help researchers to bring equity, diversity, and inclusivity in nutrition research. Here is why. Using the traditional assessments for the dietary data collection involves collecting participants' data and then connecting it with a search database, nutrient database of foods and recipes, which then analyze the nutrient composition of the food. Thus, it becomes harder to estimate the nutrient contents of the foods and the recipes if it is from a cultural or ethnic recipe or a variety that is not available in that nutrient database. So reflection spectroscopy saves researchers from always guesstimating people's cultural and ethnic variation of these foods and recipes. And it allows the researchers to estimate children's vegetable consumption in less than a minute and is beneficial to collect large-scale population level data across various race and ethnicity. So these are some of the implications for this research, really targeted to early childhood education and development, that children's BMI, body mass index, which is calculated from their weight and height, was not consistently related to their skin carotenoid scores. However, body fat percentage was. So what that means is BMI may not always reflect children's nutritional status and diet quality. And multiple studies showed low skin carotenoid score in winter, and this can be related to the lower availability of carotenoid-rich fruits and vegetables during the winter, or may represent overall low consumption and food insecurity during the winter, which is important to further investigate. And lastly, children from low-income schools had higher skin carotenoid score compared to children from high-income schools, which may be an important implications for federal school lunch programs. This systematic review abstract has been accepted for a national conference for poster presentation, and I'm working with other professors from 3 other universities in this project, and also my advisor is really helping me with streamlining the whole research and review. Okay, so the second aim in the middle box, it involves determining the factors that are associated with the family childcare home providers' perceived difficulty for adhering towards the best practices that is related to the serving vegetables for the children in the childcare settings. So why do I want to include the family childcare home providers in my research? Because they are more prevalent in the rural areas, and more rural and low-income families use these settings for their children's care. However, these settings have poorer adherence to nutrition-related practices. Additionally, these settings have lack of resources, and the provider herself prepares foods for the children and cares for a mixed age groups of the children at their own home in a limited space. You can see this in the picture in the right side of the slide. And though this brings a challenge, it also brings up an opportunity, as these providers are autonomous and they are like the sole decision makers for what type of food will be prepared in the care settings and how it will be prepared and served to the children. So, and last but not the least, family childcare home providers are really underrepresented in the relevant literature. So aim 2 was addressed using a statewide secondary data set, which involves a cross-sectional data collection and paper-based survey. For this data analysis, I have used a reflective latent variable modeling in the M+. These are the, this slide shows you the demographic characteristics of the sample, which was representative of early childhood educators in the Nebraska. Among the 943 family child care home providers in my data set, 36% were from rural Nebraska, and 30% had only high school, 28% had some college education, and 37% had a 2-year degree. The sample was predominantly white, with only 6% of non-white participants, and we had only 2.6% of Hispanic providers, and 89% of the providers were CSCFP participants, and their mean age was about 49 years. Okay, so this is the interesting results for my aim 2, my reflective latent variable model, and my outcome latent variable was providers' difficulty to adhere best practices for serving vegetables to children, which is inside this oval in the middle. And the best practices for serving vegetables include these 2 rectangles in here on the right side of the screen. So first one is serving vegetables once a day, and the second one is preparing vegetables without adding animal fat. On the left side of the screen, I have these factors that have been linked with providers' nutrition practices in previous literature. So the upper level factors in here connected with the dotted lines, they have the non-significant relationship with this perceived difficulty. And the lower level factors, which has solid lines, they have a significant relationship with the latent variable. And the results, both significant and non-significant, these are the non-significant, these are the significant, and they are very interesting because, you know, previous research has showed that rural providers have higher difficulties to serve vegetables because of low accessibility. And then lack of money was also an important barrier for the providers. And professional development helped to reduce providers' difficulty. However, these factors were not significant in my model. But I have found CSCFP participation, which is a federal nutrition program, that helped lowering the perceived difficulty, which is really interesting and also significant of the federal program. And providers enthusiastically role modeling and lacking time to prepare healthy foods and children's taste preferences for healthy foods were increasing providers' difficulty to adhere to the recommended best practices. So what does that results imply to is role modeling seem to be increasing difficulty for providers to meet the best practices, right? So if we are asking the provider to role model for children to improve children's vegetable consumption, and provider herself doesn't like the taste of the vegetable, it will be really hard for them to enthusiastically role model to the children. Additionally, similar to my findings, previous research also shows that providers are less likely to meet the recommendations when children do not like the taste of the vegetables. Thus, the results from my AIM2 is leading us to think, how can we encourage providers to prepare and serve vegetables in a way so that children like the taste of the vegetable and role model for them, and making professional development materials eventually for providers to help them with the adherence to best practices regarding the vegetable served and improve children's vegetable consumption. And my AIM3 involves investigating providers' current vegetable preparation and serving practices, for which I'm still collecting the data. A little bit background for you, or what that entails is that, you can see the left lunch plate shows the soggy green beans with some lonely carrots. Certainly to eat that vegetables, I will need a lot of motivation. So how about making the vegetables look better and appealing? This picture on the right and not random photos are that is downloaded from Google. They are from the CSCFP recipe books. So CSCFP, here is a screenshot for the CSCFP website that gives the childcare like multiple and many childcare recipes, which is also from multicultural recipes for childcare providers. And however, are the childcare providers are using these resources or not? We do not know that. Therefore, my AIM3 really involves a survey and to collect providers' preparation practices and qualitative interviews with providers to identify their practice and resources they utilize. Here is just my next steps for the next year and this year. And I'm passionate to continue my research as an early childhood nutrition research scientist. And this is still a less focused avenue while preparing the future early childhood educators. Hopefully my work will improve educators' self-efficacy to serve vegetables to the children and improve children's vegetable consumption. And though we promote vegetable consumption, we also eat cakes in moderation. Here are my advisor and colleagues who are also helping me collecting my data. And thank you to my doctoral committee who helped me with their guidance and support. Thanks to my grantors, the Buffett Early Childhood Institute, for this excellent honor and opportunity.